now.
Yeah, thank you, Eric. Yeah, welcome everybody. This is something we wanted to do before kind of the tryout season started for the older players, high school players. Um, and we want to talk a little bit about overuse injuries in youth soccer. And then in the second part of the discussion, we'll talk a little bit about high school tryouts, which I know are coming up pretty much tomorrow. But both of the subjects are very much intertwined because obviously, as you guys are well aware, the youth soccer season is still going, and the high school soccer season starts tomorrow, essentially. So, unfortunately, there's very little time for kids to rest and recover, and we're seeing a lot of injuries. And for that reason, we brought in some expertise. So, real big thank you to Tyson Baines for coming in to provide some information on youth soccer injuries. He works as an orthopedic physician's assistant. I think he's with Golden State Orthopedics, and we're delighted to have him. Eric, anything to add before we go over to Tyson?
Yeah, I mean, so I appreciate Tyson coming. He works with my daughter. I mean, they don't really kind of tell people this, I guess, and all the times, but we're lucky to have him because, the San Francisco office of the Golden State Orthopedics and Spine is the Giants orthopedist, and the Santa Clara office is the 49ers primary care facility as well, right? I mean, and they also work with a lot of colleges. I think the San Francisco office works with USF, and I believe Tyson's office works with Santa Clara University, amongst others. So they're deeply intertwined in athletics and in at the college level as well as professional level. So we really appreciate having Tyson here, and I think you can see your slides, right, Tyson?
Yes, sir.
Okay. Anything? Did I miss anything, Tyson?
Nope, that nailed it.
Okay. So the floor is yours.
All right, so go ahead and yeah, title overuse and sports injuries. Just a little bit about me, my background. Been a PA for about the last 14 years. Just retired from the Army last June. And after 22 years, my last 14 though, my last 13, I was a physician assistant, of course, and I uh, saw a ton of overuse injuries, and they would walk through the door, knee pain, chronic knee pain, um, and we in the beginning I couldn't figure it out, and I was like, why? Why are we having chronic knee pain, and what do I do about it? Um, I had the fortunate opportunity in 2015. The Army assigned me to work with the 49ers for one year, one calendar year. And there's during that time, if you look up in the top, I'm working with Dr. Saglin Benny, little short guy, the shortest one, and he is one of the providers here in the Santa Clara office. And so it was learning from the 49ers because they have tons of overuse injuries and they have more injuries I want to talk about right today. But and it was learning the best practices and how to take that back to the military. And so if you look down and you see the flag football picture lights, me and another guy, we call this the Turkey Bowl. And every year at Thanksgiving we have this game. We play flag football. Well, that is the one single producing event of most ACL ruptures, I would think, in active duty is that one day because uh, the other 364 days we do not train glutes. We don't train posterior chain. We don't. We run. We're good at running straight, and we're good at walking for long distances with heavy packs. So why is that one day? Well, if you dig into it, it's because we do not train our glutes and we don't train our quads appropriately. So we're setting ourselves up for injury. And a lot of that will transfer into this presentation. as I go through it. And the last picture is me in the uniform. My happiest day in 22 years of service. It was my last day, and that's the day I went and signed my DD 214, which is my get out of purgatory card. And so, with that, if you can advance the slide. Um, just real quick admin at West Coast Sports, which is affiliate of Golden State. We have two offices, one up in San Francisco and one here in Santa Clara. And the couple of things I want to highlight is we do acute injury care, musculoskeletal care. We can reduce fractures, cast, splint. We have chronic musculoskeletal care. We have concussion, and then physical therapy. In the event that we don't recover from these chronic injuries, or that your athlete has an acute injury that requires surgery, we do have orthopedic surgeons on staff. And the one, Dr. Akazuki up in San Francisco, if there's any baseball parents out there, athletes, he is phenomenal in getting guys their little league elbow or the own Tommy John's procedure. So next slide.
So can I interrupt for just a second, Tyson?
Please.
So the concussion care, so Alyssa's been, obviously, I said that she works with you and with the offices, but she's telling me about concussion care, and it's like night and day from even 5 years ago. And so it's just, there's so much more to it now and more diagnoses to it. And maybe at some point you can talk about that, but it's incredible what they're learning from all this stuff.
Yeah, I can go ahead and talk about it now, so I don't lose my train of thought. 20 back in the Stone Ages when I still played with leather helmets, there was no concussion protocol, and then it was, oh, you got a concussion, you're going to sit in a dark room for the next 5, 6, 7 days, and that's how you're going to recover. Well, now through study and research, we know that the best thing is graded return. So, working kind of a stress workout until you develop a headache or symptoms, and then pull back, because the worst thing we can do is just sit down and put sunglasses on and rest, because our brain isn't able to recover. Just like if you were to have a sprained ankle, you don't want to stop moving just because you have a sprained ankle. So let's go ahead and advance. So cutting into it, there's a couple of things, body parts I'm going to go over tonight, and it's elbow, knee, hips, and ankle. Want to go over the elbow? I mean, it's humerus and the ulnus and radius. Flexes up and down, and that allows us to add some rotation in there. For the little league, the pitchers out there, you get put a lot of stress on ulnar stress when you're throwing the ball. Even when your goalies are throwing the ball back into play, it can stress that ulnar ligament. And we're going to go over some growth plate pictures when I get to the little league elbow a little bit later on. Next slide. So this is the hip anatomy. The biggest key I want you guys to, if I could take away tonight, is the hips are, I guess, the powerhouse for athletes. And a lot of times it's kind of a foregone conclusion, but if you look at the frontal view, the AP, where you can see the whole entire width of the pelvis, and then you see the femur coming down, it says external and internal rotation. It's kind of the second picture. What I want to focus on later on tonight is the importance of strengthening the glutes, because if we have weak glutes, it's going to let that femur rotate internally, which then there's going to be an angle that we look at later that it's going to set up an angle that puts your athlete at risk for ACL injuries. So, and this is the going over the knee. It's really important. I'm kind of fascinated with the hip, but the knee takes the brunt of the beatings if the hip isn't strong enough. So if the hip can't keep the femur in correct plane, the knee is going to absorb all the shock. So as you're thinking about the force generated when you kick, when you plant and land and kick, or you jump, you pivot on the field, change directions, uh, your knee is going to be forced into different vectors and put more stress on it. So uh, ensuring that you're strong starting at the hips down. So and then kind of at the bottom here, the ankles. Um, about 90% of all ankle sprains occur when you roll your ankle to the outside. So it's that first picture that's internally, but it's the last ankle that you see on the slide there. It's externally rotating or rolling over. So 90% of all ankle sprains occur there. Um, and if you have an ankle sprain and we don't recover it appropriately, then we're setting the athlete up for future ankle sprains. Then that can turn into, just having a weaker or lower extremity and potentially more uh, issues up the chain, which would be your ACL and your knees. So it's very key to keep all these joints as strong and flexible as possible. Right. So, going into the overuse injuries, you get patellofemoral pain. Probably you've all experienced it. You're walking up steps or down steps, up elevation. You feel this burning or this just aggravating pain behind your kneecap. Essentially, what's happening, if you look up on that very right portion of the slide, you see the knee is bent and you see the kneecap. You see that red dot, and even though I'm using my pointer or my mouse, I don't think you guys can see it right there. Um, if the hip is weak and that femur goes valgus, then what happens is the patella rub constantly against that groove right there, and that's an aggravating pain. So again, the treatment for that is ice rest, well, ice appropriate rest, and then getting the hips and quads stronger. So next slide. So most of I from the introduction, I believe that most of the athletes out there, right, in this group tonight are probably past Osgood Slaughters. And what's happening in this picture, in Osgood Slaughters, you got the tibial plateau right there, where the mouse is at, and then you see that little spur at the bottom right there. That's where the patella tendon attaches to that little. Uh, that's where the patella tendon attaches. Tibius, the tibial tubercle. If you're a quad dominant athlete, what that's going to do is continually force, put stress on that growth plate, and you'll develop anterior knee pain, and it's really uncomfortable. For those who've had it in the past, um, what we're talking about. And then you see in just the knee picture how you have this deformity and the soft tissue is kind of raised right there. So they'll complain of anterior knee pain, and you'll see a bump, and you're like, what's going on? Ice, rest, appropriate rest, and rehabilitating the muscles in the hip and the quads will help that. Next slide. Shin splints for those runners out there, or even in the beginning of any sports season, your athlete may complain of lower leg pain, especially when they start to run or increase their distance or increase their workload. And what's happening is the muscles in the calf, in the lower leg, are imbalanced. So there's one's too strong, one's too tight, or one's weak. And so it rubs constantly on the tibial shaft, and that can cause pain. And the key here is not to push through any of these that I've talked about. The key is listening. Okay, there's pain. I don't want to push through it, because especially in shin splints, that could be setting you up for stress fractures. And then stress fractures, we treat it as if it were an actual fracture. And so the athlete will be out when this could have been avoided through proper care and training.
So I will tell you that the 9 years of high school, because so we train 2, 3 times a week, and even most club players maybe 4 times a week at the most. When we get into high school, or when these kids get into high school, I've had more kids complain about shin splints because we're playing 5 or 6 days a week,
Mhm.
right? And they're just not used to that amount of work.
Yeah. So, um, and these are some uh, overuse injuries that are common, especially in those who haven't finished puberty yet. Seaver's disease. It's a calcaneal. Basically, the calcaneus, so the heel, has a growth plate in it where the Achilles tendon attaches. Well, if they've increased load too fast, like they did nothing in the off season, and or they've been playing year round, but then they started an event that they're training harder, that growth plate's getting pulled. So it's basically inflammation in the growth plate, and that will cause pretty extreme heel pain. And then what do you do then? You have to ice, get that inflammation down, and kind of just restart slowly back into activity. And then the little league elbow, I really like the picture of the right, yep, right there. You got a normal, so that you see that growth plate that goes across the distal, or the distal portion of the humerus right before you get to the two bones. So go up a little bit with your mouse, up. You see a line right there, that line right there. So what that's showing you, that's the growth plate in an elbow of a pediatric kid. Um, the ulnar uh, the ulnar growth plate is just on the other side. So if you can see, it says normal, then widen. What's happening is the stress when they're and when they're throwing, the stress of the ulnar collateral ligament is pulling on that growth plate, and the pitcher will come in and will be complaining, or the goalie or whoever's throwing is going to complain of pain on the inside of their elbow. And what's happening is they've exceeded the demands that their body can compensate, and they're pulling on it, and that causes a widening in the growth plate. And if to continue to push through that, then you're worried about avulsing that tubercle off. And so a lot of times, in Little League, you had to set them, you have to rest them, change positions, because pitchers is the most common, ice again, and rehabilitation. And then those, if they continue to go on, will require ulnar collateral surgery, or Tommy John surgery, to repair that. Next slide. So what I really wanted to focus on tonight is the key to prevention is the neuro pathway, neuromuscular pathway, training the body in a way that um, it's going to be able to protect itself when your athlete's out there on the field reacting to changes of directions without having to think about it. You don't want an athlete to think about what they're doing, or be too overly cautious. So the key to that is to strengthen the glutes, the hamstrings, the quads, and even the back, to ensure that um, their balance proprioception is on track. And then here I had that improving the balance on the bottom there. It's simply getting on a foam plate and trying to balance one leg, then the other leg, and just going in different ranges of motion to work that proprioception, trying to get the brain and the muscles to connect. Next slide. I think that first picture on top there, the optimizing the landing mechanics. If you have weak glutes, and so if you got a weak butt, essentially, it allows the knees, those red arrows, it allows the knees to collapse in, and valgus, go into dynamic valgus. So if they're strong, and when the athlete lands, whether it's on both feet, whether it's on his plant foot before striking the ball, it allows the knees to stay in a correct position, and it keeps the stress off that patella, um, from sliding and hitting the femoral condyle, it allows the ACL to remain in a safe position. And so the more times you can, if you watch an athlete in a simple way, I got this knee model. I don't know if you can tell, but it's the kneecap and the femur. So if you watch your athlete and they're doing a body squat and with just plain body weight, and it rotates in, it collapses in, then you got to start thinking about the glutes. Those they're weak glutes, they're weak quads, and weak core, because you should be able to do a squat and keep the knees from rotating in. So um, that's making sure that everything is aligned up, neuromuscular pathways lined up, and they're strong enough to compete. And then just talking about the training load, it sounds like you guys almost are year round. You can correct me if I'm wrong, but it sounds like you guys are,
Well, we actually take 6 weeks off about in summer and winter, so we're one of the few clubs that do.
okay.
And we think it's important.
Yeah. So just managing, when those athletes come back or they're about to start soccer now, um, is to, you don't want to go from running and loading 3 miles in practice to the next week 10 miles. All right, you're overloading, and now the muscles are fatigued, and it's when we get fatigued and tired, the brain wants to keep going. The brain's going to go. The coaches are yelling, "Go, go, go!" The drill sergeant, the whatever is, go. And then we were wired that way. But what happens is we get tired and we start moving in poor movement patterns, and then that sets us up for that injury. That whether it's a sprained ankle, whether it's patellofemoral syndrome, it sets us up for that. And then we're trying to push through the season, and then we get late in the season, and then the injuries really start to multiply. We can keep a good balance. So, moving on to the next slide. So, West Coast Sports or Golden State Orthopedics and Spine partnered up with Hurt, and Hurt is an app that you can download and get free orthopedic advice. It could be on the field, because a lot of times, as a parent, is this something I take to the ER? Is this urgent care, or do we just wait? And so this app allows you to download. You can take pictures, video of how that your athlete is moving, and send it in. And then there's a orthopedic specialists who are able to then look at the videos, look at how the injury occurred, and then provide you information. Oh, this is something that's non-acute, it's chronic. Recommend taking to the PCM, or hey, this needs to be seen right now, or an urgent care. So it really gives patients, parents, a peace of mind. Okay, I can wait till tomorrow. I don't have to go sit in line at the ER or urgent care for 6 hours. So, next line or next. So
people say they can't see, so hold on one second. Let me reshare again. All right. Can you guys all see that screen? The Hurt screen? You see that? Yeah, no? See anybody? Okay.
I
Rich,
can see it, yeah.
Okay. All right, perfect. Go ahead.
So the Hurt app is it's a great free resource to get that what do I do next? And on the sidelines, if you're 18 or older, then you can set your own account up. It's really easy to set up. I was even able to set it up when I'm not able to load my own slides onto the and give it to Mr. G tonight. So I was able to do it, and I use myself as a test patient. And what it will do is if I do need future care, like delayed care, it will give me a list or options of places that I can go that have the specialty that I need. So
I did try it. I did check it out when I first talked to Michelle. It's actually pretty informative.
Yeah. Yeah.
And it's free,
Um, yeah,
which is
and
nice.
it's free. That's the part I liked about it is, I can give it to my kids, and it's not just in the Bay Area. It's nationwide. So I've got a kid that's in Utah going to school. Send it to him. That way he's not waking me up in the middle of the night asking me
Yeah.
stuff, questions. But uh, go ahead and next slide. So if there's anything about your questions, if you have any, but the key takeaway is for
Another
me,
slide. Yeah. Okay.
I don't have any bullet points for that. Is
Okay.
to work on you don't know what to do, work on glutes. I used to make fun of Jane Fonda's and the clamshell and all that, but now I uh, have parents, patients doing. I do it every before I work out, is working on those muscles I don't think about, to preserve my knees in the future, and I can tell the difference. So um, and you don't just don't underestimate the power of warming up and getting the muscles primed and to move.
Yeah, but it was good because we do people again. They do a lot of quad work. They do a lot of flexibility, agility stuff. The glutes get ignored a lot, and that's kind of where the science is pointing us.
And the patellofemoral, the ankle sprains, that those are all kind of like indicators. Like when you're driving your car and you got a warning light coming up, something's about to go wrong if you don't take it to the shop. The same thing with that, like nagging anterior knee pain, nagging hip pain. That means if we don't take care of that and we just keep riding, pushing it to the red line, we're setting people up, athletes, ourselves, for knee, traumatic injury.
Tyson, I have a question. That was great. Thank you. Probably with my parent hat on, right? Um, for the first time this weekend, always with the coach's hat on, but almost with a parent hat on right now. Like first time this weekend, my son is at 11 and got kind of clattered in the game, came home with some knee pain. And we've also had just bigger picture wise, like we've had some pretty traumatic ACL injuries within the club in the last 12 months, many more than we've had in the past. And everyone that we hear about is just so painful to hear about because you know how impactful that is on a kid's life and being out of a game that they love for a year, but also the amount of work they have to go through to rehab an injury like that and mental health alongside the stresses and strains of school. And as a parent, you look at that and you think like, whoa, that's really hard on a parent too to manage that. So, I guess my question is like, one of the big takeaways that I'm hearing is like strengthening the glutes, the hamstrings, the quads, the back, your core strength. When do you start? Like my son's 11, like, when, we were always told when we were younger, like, limit the weight training, limit stuff like that until you hit puberty. Like when can we start working on that stuff above and beyond just the game working on that stuff kind of naturally?
Yeah, that's a great question. So you can start. You we we need to shy or tend to hesitate to talk about strength training, like with weights and adding weight, because the growth plates are still open, and you don't want to injure the growth plates by doing heavy squats or deadlifts. But even when they're young, 5 to 6 years old, um, being intentional about those lateral movements, being intentional about doing clamshells, just body weight movements. So their forming brains can connect with the forming muscle to get into that movement pattern, that allows them to grow, and without injuring growth plates, without you know um, putting further stress on their bodies.
Interesting.
Did that answer your question?
Yeah, yeah. No, absolutely. So like, obviously not adding weight, but just doing things with, exercises within their body weight, which is going
Yeah.
to strengthen those areas. Yeah.
Things like
I,
plyometrics, right, Tyson? I mean,
uh,
plyometrics.
plyometrics. Yes, sir. Yeah, a lot of, and I think it's in soccer, it's kind of more, you have in soccer more opportunity, but a lot of lateral movement, back and,
Yeah.
side to side movement, not just straight ahead movement. Because, um, and playing football for many years, I was always worried on 40, but I never worked on my lateral movement. So any chance you get to get a kid to move side to side is very important because it's forcing those glutes and those hip abductors to work. So my daughter just she's 18, on my ACL. She just tore her ACL again for the second time, uh,
Oh,
as a ballerina, and she
wow.
she tore it at a audition to make a company, a professional company, and it's crushing. Uh, and always as a parent, you're playing through your head. What could I have done? What could I have? How could I have helped my child?
Yeah.
And being in orthopedics, you know, it just crushed me.
Wow. I'm sorry to hear that.
Yeah.
Yeah, it's so hard. I think I have a small feeling of that because when we hear about our players,
Hmm.
going through it, that's exactly the feeling. It's like, what could we have done more? How can we do more? So, but I think education is just key. That's really the beginning point of it. Um, and then, hopefully guiding the players into taking care of their bodies and strengthening those areas and all the other stuff like good nutrition and
Yeah.
sleep
Sleep.
and
Sleep
taking
is,
care of
yeah.
themselves. Yeah.
Yeah. And it's, and especially in youth sports, you've got the athlete, you've got the parents, you've got the coach, and you have all these different demands. So it has to be, communication is important. Communicating, the parent or the the athlete advocating for themselves. Hey, my knee is hurting or my hip is hurting. Um, you know, Learning the appropriate time when to bring that up. And in my opinion, too early is not a bad thing. That way you can start getting the remedial training or exercises you need.
Oh, you kind of mentioned that the hip was your thing, I think, earlier, and I coach predominantly, um, middle school, high school girls at this point, in my coaching career, and I see a lot of hip injuries and complaints with pain in and around the hip. Could you talk a little bit about the hip?
Yeah, I wish I had a hip model. But I don't. So I'll use my hip. So if you see me standing up. So outside out here, the lateral hip, that's like bursitis out here. Now, when the athlete starts talking about internal, like anterior pain or pain that radiates into the groin, then you start to your ears should perk up and think, well, is this hip flexor or is this labral tear? And and so that's a very tricky thing to have to suss out on the sidelines. So at that point, if it's anterior or it's going to the groin, um, it could be labral or it could be hip flexor because your iliopsoas muscle, it's a big prime mover and it goes from the lumbar spine all the way down into the top of the femur. Um, there's no way I can go back into the slide, but um, it could be tight hip flexors. They're causing a lot of that pain. That can be stretched out versus a
Hmm.
labral tear. So
Okay.
I think the key thing that you said though is communication, right? And listen to your body and bring it up to your coach or parent. or both, right? And make sure it's communicated what kind of pain, what is happening. A lot of kids don't tell us what's wrong, right? Or they don't tell us that something's hurting. And, I think pain is there for a reason. Right? It's an indicator of something's going on.
Yeah. Yeah.
Does
Yeah,
anybody
and
have
that
questions? Sorry, go ahead, Rich.
Sorry, yeah, I was just going to say that kind of transitions nicely because one of the things I used to see in tryouts a lot is kids not telling us that they were carrying something because they were trying to make the team, um, and making things worse. So obviously the second part of this is we want to let Tyson go and enjoy the rest of his evening, and we're going to transition into a tryout chat. But if anybody has any, direct questions for Tyson, I think there's one in the chat right here from probably Hugh, I think. What can you do to strengthen your hands for goalkeepers? And is there anything you can do to protect the head from concussions?
Anything? So I'll start with the last question first. To protect your head from concussions.
Mm,
It's really working on proprioception and balance. You know, that it, putting yourself in a position where you're focusing on that there was a picture of a blue foam mat that kid was standing on in one of my slides,
yep.
working on standing on one leg and balancing, getting your body and your muscles kind of in tune to, you don't want to be out of position because you're off of balance, and then you can't protect yourself when that person, there we go. Uh, these are great. That's a great, you can go online and probably Google balance improvement and come up with, several different options of that, versions of that. So what you're doing is you're able to, um, your body's able to sense where it's at in relationship to the head and to the knees and to the hips. And so we get out of position, whether it's because we're off balance or because we're too weak or we're too fatigued. And then that sets us up to lead with the head and put our heads into I guess danger zone of getting collided with. With the hands, one thing I like to do is to put just simply putting your hands in a bucket of sand or a bucket of rice, just gripping, grip, 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 or holding a hammer or a golf club and working on pronation or in supination. Just and so you've got that weighted head that's um, forcing you to work the flexors and extenders of the wrist. So if you can work on the flexors of the forearm and the extenders, that's going to give you stronger hands, or that's going to keep the energy from being absorbed into the wrist and fingers.
Awesome. Thank you. It's a great answer. Good question. Thank you to the Plits. Anybody else have any questions for Tyson before we let him go?
Thank you, Tyson.
All right. Thank
Appreciate
you so
you
much,
spending some of your
Tyson.
Sunday evening with us.
I appreciate the opportunity. All right,
All
have a good
right.
season, guys.
Thank you
Thank you,
so much,
Tyson.
Tyson.
Mhm.